Slips, Trips, and Falls Part 1. In this video on slips, trips, and falls, we'll discuss what slips and trips and falls actually are and how common they are, and you'll get some tips on preventing them from happening to you. If you don't know who I am, my name is Martin Lesperance. I'm a retired paramedic and firefighter, and I've treated literally thousands of older adults who have been injured or suffered a medical emergency.
Now listen really good, because this guy knows what he's talking about. He knows a lot about safety for us older adults. So if you're looking for a way to keep your residences safe and injury-free, this is the program for you. Let's hear it for Martin Lesperance.
I learned a lot from those experiences, and in these videos I can help you stay fit, active, and injury-free in your golden years. So let's get started. Slips, trips, and falls. Now this is a rather large section, so I broke it down into smaller parts. Why is it such a large section? Well, this is one of the main concerns people our age have. Falls, because of slips and trips and stumbling and losing our balance, are one of the most common cause of injuries to us older folks. Most of us can talk from experience when it comes to falls. We fell when we were learning how to walk. We fell when we knew how to walk. And we may fall as we age, but we don't have to. Falling is not a normal part of aging. We don't have to fall. I'll say it again. Falling is not a normal part of aging, and we don't have to fall. When writing this program, within 3 weeks, one of the past Prime Ministers of Canada, Brian Mulroney, and a former senator in the United States, Joe Lieberman, died from complications from a fall. They were in their early 80s, and they still had a lot more to offer the world. I'll bet if they were younger and had that same fall and that same injury, it wouldn't have been the cause of their death. Injuries from falls can range from a broken wrist, legs, hips, ankles, and head injuries, and that's just to name a few. Pretty well any part of our bodies can be hurt from a fall. We want to prevent falls from happening to you. We must not fall. Here's some information to show just how common falls are. It's from the Center of Disease Control and Prevention, the CDC. They are an excellent resource on aging. They tell us the following. Now, these stats are from the United States. But as we age, 65 years and older, 1 out of 5 falls end up with a serious injury, such as broken bones or a head injury. Every year, 3 million older adults are treated in emergency departments for injuries they received after a fall. 800,000 of them will be hospitalized as a result of those falls. More than 95% of hip fractures are caused by falls, usually by falling sideways. About 300,000 will end up being hospitalized because of these injuries. 40% of nursing home admissions are a result of complications from a fall. If you fall and you're injured, there's a good chance you're going to need extensive help. You may not go back to the way you were. Your life, as you knew it, has changed big time, and it can be the start of a downward spiral. Falls not only break hips and other bones, but they are the most common cause of traumatic brain injuries in the older adult. So, we must not fall. This isn't meant to scare you, but it's meant to make you more aware of the increased chance of falling as we age. But here's some good news. Falls do not have to happen, and we'll talk about what we can do to prevent falls as we get older. You see, we don't have to fall. I'll go into more detail on falls so we can prevent them. Remember, falling is not a normal part of aging. Did you know Dr. Atkins, famous for the Atkins diet, did not die as a result of a heart attack like so many people think? Dr. Atkins died from a fall, a same level fall. You see, he was walking along the sidewalk in New York City, slipped on some ice, his head hit the concrete, and they took him off life support several days later. You see, if someone falls from a 100-foot or 30-meter tower, that's going to make the 6 o'clock news because it was a spectacular fall. But if a person falls down a few steps, hits their head, suffers brain damage, and dies 3 days later, chances are you won't hear about it unless you knew the person or that person was famous. We must not fall. whether it's a big fall or a small fall. And that's going to be the theme of this section.
We must not fall. I'll say that again. We must not fall. We must not fall.
Let's develop the we must not fall mindset. What is a slip and a trip? Slips and trips cause us to fall. A slip happens when there isn't enough traction or friction between the surface you're walking on and the sole of your footwear. Some examples are stepping on water, oil spills, ice, maybe from freezing rain, and even a plastic bag on a carpeted floor will reduce the friction enough where you could slip and fall. A trip happens when your foot hits or catches an object, causing you to lose your balance enough that you fall or stumble. Some examples and causes include hoses or electrical cords on the floor, wrinkled carpets and uneven pavement, and that's just to name a few. Cracks on a sidewalk can trip you up, and they not only can trip you up, but they can also twist your ankle. A fall is a sudden, uncontrolled descent, like this. Okay, he never got hurt. Most falls happen from the same level or from a lower level, like not very high. Of course, if you spend a lot of time at heights, like on ladders or roofs, chances are your fall is going to be from a greater height. But I don't think too many of us spend much time at heights as we used to. But some of us may still find ourselves on a ladder now and then. This is important. You don't have to fall from a great height in order to be injured, and I mean seriously injured. A fall from tripping on a carpet or missing the last step can dramatically change your life. And a fall can happen so fast, at any time, anywhere, and to anyone if you're not careful. So, we must not fall.
Hey everybody, just remember this important phrase. You must not fall. Keep that in mind. Thank you very much.
Here's another point. It's not only the fall, but what you land on has a big effect on the injuries. Here's what I mean. You probably don't remember the name Ola Brenkert, but he was 61 years old and he was the drummer for the band ABBA. One day he was in his kitchen and he was walking along to a glass door that separated the outside and the kitchen, and he stumbled, he fell, he went into it and he ended up cutting his neck, and he wrapped a towel around his neck and he made it outside, but that's about as far as he got because he ended up bleeding to death in his backyard. So it's not only the fall, but what you land on has an important bearing on the injuries. Why does the risk of falling increase as we get older? Well, here are some of the reasons and the risk factors that can increase our chance of a fall. You may notice you're experiencing one or more of these. If you do, mention this to your physician. They may send you to an audiologist to check your hearing, an optician for your vision, and they may send you to other specialists. Also, your physician should be able to point you to a program to help prevent falls. Dealing with problems early can prevent serious negative outcomes later. As we age, we get weaker. We lose muscle mass and we lose muscle strength. Even Arnold Schwarzenegger does. He is not as strong as he once was. He's still strong, but he's losing his muscle mass and he's losing his muscle strength.
Matt and I could still throw you over your house.
I bet you're losing your muscle mass and your muscle strength, because I know I sure am. Remember when you were 25 years old, you were able to push start a car uphill. You were able to do incredible feats of strength and balance. Now we find lids on jars are put on way tighter than they used to be, and we may even need help to get those lids off. We're lucky now because you can buy devices to make it easier to get these stuck lids off. Weaker muscles can make it more likely we do fall. We want to do our best to keep our muscles. And since we can't send for a Charles Atlas program that was always advertised at the back of comic books, the getting sand kicked in your face on the beach ad, now we have to do other things to keep our muscles. And being active is one of them. The medical term for losing our muscle mass is called sarcopenia. As we age, we can expect it to happen. We gradually start to lose muscle mass in our 30s and our 40s. But as we reach 65 years old and up, the rate of losing our muscle mass will increase. Lack of physical activity can increase and speed up the loss of our muscles until we are a mere shadow of what we once were. Staying active can slow your loss of muscle mass down. Medications. As we age, we may be taking medications or more medications than we did in the past. Prescription and even over-the-counter medications can affect us. You may have been prescribed medications like tranquilizers, antidepressants, or sedatives, and these can potentially cause drowsiness. Certain medications can also cause you to become less alert, and they can affect your balance. Even over-the-counter medications can have an effect on your level of consciousness and your balance. Some medications can also cause a change in your urinary habits, which can lead you to having to rush to the bathroom. And rushing increases the chance of a slip and a trip and a fall. It's important to have your doctor or pharmacist review your medications. Also, if you're seeing more than one doctor, make sure you share this information so each doctor knows what medications you're taking. I found the pharmacists I see are a great resource for so many reasons. They are knowledgeable about my prescription drugs and over-the-counter medications and the health supplements I take, which may affect the medications you take. You should always let your physician know what supplements you are taking, as they can interact with the medications you are taking. Our balance isn't as good. Now, this is another situation that can increase the chance of a fall. We tend to lose our balance as we age, or at least it wasn't as good as when you were younger, and that combined with weaker muscles and slower reflexes can make it harder to regain your balance if you do stumble. There are programs and exercises that can help you improve your balance. Talk to a physiotherapist or an occupational therapist for advice. If you're in a retirement home, well, they may have programs set up already for you. Take advantage of any of the programs they offer. If you're not in a retirement home where they may already have programs for this, ask your physician about programs that you can access, and they can probably point you to the right direction. Follow up on their advice. Getting good advice doesn't help if you don't follow up with it. If there's programs close to you, take advantage of them. For example, Tai Chi is an excellent way to improve your balance and movement. There's a good chance there are exercise programs close by that can help you with your balance. If you notice you're having to hold on to something like furniture or walls more often than you did, well, this could be a warning sign. The National Institute on Aging has many videos on different exercises. They are very well done, and the information is put across in a very easy to understand way. With these videos, you don't have to leave your home. Although, if you are going to classes, there is a social aspect, which is valuable. Always talk to your healthcare provider before you start any exercise programs, though. We lose our flexibility. As we age, our joints and tendons and ligaments just don't work quite as well as they did 30 years ago, maybe even 3 years ago. Remember, exercise is good for our muscles and our joints, and you don't have to be doing exercises like this. But even some easy gardening will help. It'll get you moving. Medical conditions can affect us. Conditions like arthritis can limit our motion and flexibility. Arthritis of the knees, hips, and anywhere else can cause pain when you move, which affects the way you walk, and this can increase the chance of a fall. This is something you should take up with your physician. Our reflex is slow. We're not as fast as we used to be. Our reflexes slow down, and with our weaker muscles, it's harder to regain your balance when you do stumble. Our coordination isn't as good either. And not being able to catch yourself if you do stumble, and with the weaker muscles, well, this increases the chance of a fall. And remember, we must not fall.
We must not fall. I'll say that again. We must not fall. We must not fall.
our gait can change as we age. We're not talking about this kind of gait, but this kind of gait. Gait means the way or the pattern or manner you walk. And as we age, there's a lot of different reasons our gait and the way we walk can change. In folks around 60 years old, about 15% of people will have an abnormal gait. Once we reach 85 years of age, and over 80% of us will have a change in our gait. If you watch Monty Python's the great show, ran from 1969 to 1974, you may have seen John Cleese doing his silly walk. Usually, our gait isn't as dramatic as his, but it can be more like this. A shuffle or a limp or just moving really slow. Speaking of Monty Python's, here's an interesting point. One of the stars, Eric Idle, is now promoting early detection of cancer. You see, he was in for some routine tests and he discovered he had pancreatic cancer. Because it was caught early, the treatment worked. And he's doing fine. And now he promotes early detection of cancer. It saved his life. He not only made millions of people laugh, he is now saving thousands of lives with his message. So what can cause our gait to change? There are several conditions that can cause this. Arthritis, injury, Parkinson's disease, gout can all change our gait or the way we walk. And if you've ever had a bout of gout, you know what I mean. You don't walk the same if you walk at all. Stroke and inner ear problems can affect our balance, which would change the way we walk. Back pain or pain anywhere else can change the way we walk. A change in your gait can show itself by not lifting your feet high enough. You're shuffling when you walk. This can make it easier to trip over carpets or rugs or anything else like a crack in the sidewalk. A change in your gait can show itself by limping, taking shorter steps, and dragging your feet, and that's just to name a few. It's unlikely you'll see a dramatic of a change in gait as this. If you're experiencing a change in your gait, and if you haven't already, see your healthcare provider. They may suggest using a cane or a walker to help prevent the fall. Having an abnormal gait is not normal. Get it checked out. Proper medical care may be able to help. Thanks for watching. Now, if you enjoy these videos, please like and subscribe to them. Also, feel free to add any comments. There's a lot of people like you with life experience watching these videos, and we can learn from each other. And this will help me make better videos.